Hello again from Geneva and WSIS Forum 2022. I'm joined by Mubaraka Ibrahim, who is Acting CIO of Emirates Health Services in UAE. Welcome. And I know you've been talking at a couple of major platforms about how ICT is delivering better health services in UAE. Could you tell us about that, please?
Yes, first, thank you very much for hosting me. And regarding that, actually, we talked about how in the UAE, we have utilized the technology to, fight COVID when we had the COVID regarding, introducing a lot of the telemedicine. We've actually implemented, apps that can help the patients, to register their booking for vaccination and all that. So there was actually a workaround, how we deploy the technology to help, the COVID-19 pandemic. And we were very successful in that part since we have introduced a lot of technologies. I'll give you an example. We have done the COVID-19 app, which we have currently 1.7 million downloads on that. And for this app was at first introduced to have a lot of information about the COVID, and then it was introduced where they have an appointment for them to do the vaccination and the PCR. So there is a lot of people who have utilized that so that we can organize the process of how they can do the vaccination and also the PCRs. So that was one of the successful projects that we have done. We have done the virtual clinic because you remember at the beginning of the pandemic, a lot of people didn't move out of the houses. And so we wanted actually to reach them within the comfort of their home.
And these innovations, will they continue to be used now that people can move more freely?
Yeah, actually, it's more around how these tools and technology will help them actually to reach them wherever they are. Before they have to travel to go to doctor, they have to travel to go to a consultant. Now, why should we do this? We can actually, even while you are driving, you can go online and see, your doctor. You can communicate with him, and you can see, there's in the future also they will be introducing more of, gadgets that they can, put so that they get your assessments online. So I feel as a technology, this is a leap of how we are introducing our healthcare, and it will continue in that direction.
Is there a danger, do you think, that sometimes people the technology goes too far in the sense that some people still want that face-to-face contact? Or do you think we've reached now this place where we understand a hybrid way of delivering services is much better?
Well, I do agree with you that we should be having a hybrid way, but there are some, certain cold or certain disease that you don't have to go to a hospital or an ER. And there are people who have first priority on that. So if you have some sort of, light symptoms, some sort of, disease or anything, the doctor can go online and can help you. But if there is something that is really, wants the doctors to be available to give them the care face to face, then yes, I do agree that there should be a hybrid approach.
So it's a sort of sensible use of ICTs to maintain inclusivity, so that no one gets left behind, essentially.
Yes.
Brave new world of tech medicine.
Yeah. And there is a lot of technologies that, it's introduced nowadays. Now in the UAE, we're utilizing the AI and the machine learning to do a lot of prediction going to the future. And one of the things that we have done during the COVID-19, we did something called risk assessment factors, where we have actually collected all the data of all our patients, that we have in our database. And we were able to estimate who are the patients who have risks if they didn't have a vaccination, or risk if they have the COVID for them to be hospitalized. And this actually gave us the management to see where they need to increase their resources when it comes to patient, doctors, or even bed occupancy. So they know that in this area there's a huge number of people that has these type of risks. So we can end up preparing more of an ICU beds so that we can manage these cases.
It sounds tremendously innovative. Mubaraka Ibrahim, thank you so much for joining us.
Thank you.